Welcome back. Good oral health is serious, but that doesn't mean your dentist office needs to be boring.
That's right. Molly had the chance to visit a place where not only do they make your kids comfortable, they actually have fun. Take a look.
All right, Molly, we're all ready for you.
So Dr. Angie, I was in the waiting room. There are tons of great toys, there are books, there's an aquarium, there's kids' movies playing on the TVs. This is a fun place to visit.
Yes, it is. And aside from the obvious kid-geared furniture and decor, movies playing, depending on which day you're here, you might experience one of our fun theme days. We just had a pajama day last week where all of our staff and some of our patients dressed up in their pajamas. We also have special pediatric-sized equipment, instruments to make things like taking x-rays or receiving treatment and procedures easier for kids. All of the doctors and staff have a lot of extra training and many years of experience helping kids of all ages and all different types of dental backgrounds and special needs with becoming comfortable in the dental environment.
I bet that gives parents a lot of comfort to know how highly trained your staff is.
I think it certainly does. As pediatric dentists, we go to 2 years of extra training in a program to become more familiar with kids' teeth, the procedures that they need, and also in managing kids and how they experience the dental environment and procedure specifically.
What do you think is important about understanding that, and that kids maybe have a different experience visiting the dentist than an adult would?
Well, you really need to approach their first experiences with the dental environment and procedures in a different way than an adult. Use more kid-appropriate or kid-friendly terms, and just be very gentle and delicate about how you introduce them to these first experiences to make it fun and positive so that they build confidence and become comfortable with the dental environment.
Dr. Ed, this is such a comfortable room. It's quiet too. It's got coffee service. This would be a nice hangout, I would think, for parents as we would wait for our kids to be in the dental chair.
Yeah, it sure is. If the parents don't wish to share the dental experience with their kids, they can come here, hang out in our coffee shop, have a cup of coffee, or on certain days we offer a chair massage by our massage therapists so they can relax while their kids are having fun.
How do you help parents who are hesitant to bring their child for their first dental visit, or kids who maybe seem a little hesitant?
Well, that's all part of the job, and one of the things we do is to create a relaxed atmosphere. We have an open, comfortable environment that helps kids to feel more relaxed, and the parents, I think, really pick up on that as well. It's not the dental office they are used to or remember. They're much more relaxed and at ease.
What's the importance of an early dental visit? Because I know you encourage that at 18 months or even younger.
Yeah, we recommend bringing kids in around their first birthday, and that's something we've been doing for quite some time. The reason for that is we're trying to see the kids about the time they're getting their first tooth in, or they're just getting their earliest eruption of teeth. And we can also educate the parents at that time, because parents want to know what their responsibilities are, and we're here to fulfill that. So we can see the child, assess their risk factors, and we can diagnose potential cavity problems early on, orthodontic problems often as well.
Speaking of cavities, they still exist, although it seems you hear fewer and fewer kids saying they have cavities. And is sugar still the main culprit?
The problem is cavities and dental disease is a very complex disease. So there are many factors involved. So sugar, yes, it's a complicated process. It's not how much sugar you eat, it's the frequency of sugar, and any kind of food that is sticky, contains sugar, or is acidic can contribute to your decay rate. So part of our job as a pediatric dentist at the Fun Kids is help to identify those risk factors early on. We urge parents to take control of those things that they can, such as diet, and oral hygiene. And that way we're tipping the scales in favor of dental health.
What's something a child might say or a parent might say to you that makes you feel good about what you do here at the Fun Kids?
Kids typically will say, gee, that was fun. And that's telling us we're doing the right thing, I think.
Cute. Well, not only does the Fun Kids dentist welcome kids with special needs, they take their time with them. They've got a lot of kids who are on the autism spectrum and are very comfortable providing care.
So if you want to take a tour or make an appointment, visit the Fun Kids Dentist on Bluemound Road in Brookfield. They also offer a complimentary well baby checkup for any kids 18 months and younger. To schedule your appointment, just call 262-786-1270 or visit them online at thefunkidsdentist.com.